So as I said, I'm going to start off with the deltoid muscles, which allow for abduction, and their origin points vary, but they all insert into the deltoid process of the humerus. So here's the humerus just in the background, and here is the deltoid muscle. There's an anterior, middle, and posterior compartment to them, which kind of have slightly different actions. So I guess just starting with the posterior compartment, you can kind of see how the fibers differ along the posterior compartment than, say, just try to rotate my wallet here, than say the middle compartment. And the posterior compartment allows for external rotation and extension, and then all three allow for abduction. So they have, to some extent, allow for external rotation and extension of the arm. You can imagine as this is pulling in this direction, you're going to, from the anatomical position, your thumb's going to move laterally, so you're going to be externally rotating your arm. On the flip side, if you go to the anterior portion, it allows for flexion to some extent as well. So I guess just their attachment points, basically mostly the spine of the scapula for the posterior, the acromion process for the middle. Here's the acromion process. And then the lateral 1/3 of the clavicle for the anterior portion, which you can see pretty nicely right here. Basically, just to reiterate the action of the deltoid muscle, a couple important things need to be considered. First of all, as we've talked about a lot in class, it can't abduct the first 15 degrees of your arm. So if your arm's lying straight at your side, that first 15 degrees, the deltoid muscle can't abduct it away from your midline, just from the plane of the lever. So the deltoid muscle would just be straight up and down if the arm was right at your side, and then so it would have no lever to pull on and thus pull your arm up. So that's when the supraspinatus muscle comes in, which is right here, and it travels between the acromion process, which is right here, between the acromion process and the head of the humerus to insert on right around here. I guess I can actually show you on this side. So here is the supraspinatus, and I'm just going to get rid of the subacromial bursa and the subdeltoid bursa. Here's the supraspinatus traveling underneath the acromion process and attaching to the greater tubercle, so greater tubercle of the humerus. And that is needed, that lever is needed to accomplish the first 15 degrees of abduction of your arm. And then from 15 degrees on, the deltoid takes over. So from, just trying to mark it up here, so the deltoid takes over from about here until your arm is straight outwards from your body. And then from that point, you could see that the lever would be back to being useless because the deltoid would be on the same plane as the spine of the scapula and the acromion, so it can't lift above this line. So to lift above that line, the scapula needs to descend, and the arm will ascend as the scapula is descending. And if you remember kind of my dot model thing, if you have clockwise, on the left side that is, if you have it going clockwise, this will be descending and this will be ascending, like so. And one second. And that is accomplished largely by, I believe largely by the trapezius. Yeah, largely by the trapezius. Sorry, I just don't have the trapezius on here, so it's kind of a bit harder to visualize. But yeah, that's accomplished largely by the trapezius, which allows you to move your arm above this line and kind of up over your head. So just to reiterate, the first 15 degrees of the supraspinous, from 15 to this plane is the deltoid muscle, which is all abduction, and then above your head your scapula needs to rotate internally, largely aided by the trapezius ascending or superior fibers attaching to the top of the spinous process. So just to talk about the nerve supply of the deltoid. Basically, it's supplied primarily by the axillary nerve, and like pretty much everything in that we talk about in the rotator cuff and the deltoid and even some of the back muscles, it's also supplied by the brachial plexus, which is C5 and C6, but we're going to talk about that on Monday, and then I'll make a video about it after we have a good lecture on it. But as you can see, this is the axillary nerve, which is innervating the deltoid muscle. And the axillary nerve kind of travels through an interesting space, which I'll talk about after finishing up on the deltoid muscle. But the next thing I wanted to talk about was the arterial supply of the deltoid muscle, is basically the posterior circumflex humeral artery. And if we go to the right side of my model, so the deltoid is on the left, I'm going to the right, and zoom in a bit, you can see that this is the anterior circumflex humeral artery, and then anastomosing with that is the posterior circumflex humeral artery. And these, the posterior circumflex provides blood to the deltoid muscle. And given that it wraps around the surgical neck of the humerus, if you damage the surgical neck of the humerus, there's a chance that you'll damage the posterior circumflex humeral artery and damage the blood supply to the deltoid muscle. Similarly, although it's not shown here, sorry, just going to zoom out a bit and come back to the deltoid side or the left side of my model. If I fade the deltoid, you can see that similarly the axillary nerve, which is right here, travels around the neck of the humerus as well. So it sends a branch around the neck. So if you have a damage in the surgical neck of the humerus, it's very probable, well, maybe not very probable, it's possible that you'll have damage to the posterior circumflex humeral artery as well as the axillary nerve, both of which supply the deltoid muscle. And then the deltoid muscle to some extent is also supplied by the deltoid branch of the thoracoacromial artery. And both of those arteries which I discussed, the posterior circumflex and the thoracoacromial artery, are branches of the axillary artery. So basically you have the subclavian artery, and then it turns into the axillary artery. Now, as we talked about in class, the axillary artery is broken up into three sections. The first section has the superior thoracic artery, right here, coming off of it. And then the first section has one branch, the second section has two branches, and the third section has three branches. So the second section has the thoracicoacromial artery and the lateral thoracic artery. So this is just a branch of it. So basically it's kind of this trunk right here. And then I don't believe I have the lateral on my model, just because I basically just forgot to put it on there. But the lateral thoracic artery also comes off this second segment of the axillary artery. So back to the thoracicoacromial artery, it has a branch of it called the deltoid branch, so it has four branches, the clavicular, acromial, deltoid, and pectoral branch, but one of its branches is the deltoid branch, which is in part supplies the deltoid. And then finally, the third section of the axillary artery, so just re-hide the axillary artery, the third section sends off the posterior and anterior circumflex, and the anterior is kind of in here, as well as the subscapular is also in there, but kind of hard to see. But the third section has three branches: the anterior circumflex, the posterior circumflex, and the subscapular. The posterior also helps provide blood to the deltoid, and as I said before, can be injured. And the subscapular actually provides blood to a lot of the rotator cuff muscles, which I will talk about shortly. So that's the anterior, and just going to hide a few of these just to get them out of the way. Alright, and then I believe this is the subscapular, so it's really hard to see, but it's kind of in the axillary region. If I show you an inferior view, it's easier. So you have the axillary, the anterior circumflex branch, the posterior circumflex branch, and here is the subscapular, which very, very quickly gives off the circumflex scapular artery and the thoracodorsal artery, or thoracodorsal artery. And the circumflex scapular artery is going to be important for when I'm talking about a lot of the blood supply of the rotator cuff. Sorry. And then the axillary artery just basically turns into the brachial artery. And then I'll have a section kind of on the upper arm later, but the brachial artery basically supplies the anterior compartment, the biceps brachii, coracobrachialis, and the both heads of the biceps brachii and the brachialis. And then the brachial artery gives off a branch called the deep brachial or the profound artery, which supplies the posterior compartment of the upper arm. But I'll have another video on that later. So, enough of the deltoid, and enough of this blood, talking about the blood supplies for now. The next thing I wanted to talk about was the quadrangular space, because I think this is something in particular that's really hard to grasp without models, basically. So there's a couple important landmarks for defining the boundaries of this quadrangular space. Basically, superiorly, we have teres minor and the subscapularis. The subscapularis is right here. It's kind of, if I rotate around and if I get rid of the serratus anterior, you can see it right there, attaching to the subscapular fossa on the other side of the scapula. So we have teres minor and subscapularis through there. Below we have teres major, which I have faded here. Medial we have the long head of the triceps brachii, so medially. And then laterally we have the surgical neck of the humerus. So around here is the surgical neck of the humerus, whereas the anatomical neck's higher. And so right here is the quadrangular space, basically. And through it comes the posterior circumflex artery, as well as the axillary nerve, which I don't have on the right-hand side of my model. But basically, so those are the boundaries. So superior teres minor, medially triceps brachii long head, laterally the surgical neck of the humerus, and then inferiorly teres major. So kind of right in here is the triangle, just to be more specific than this angle, but if you kind of rotate like this, right in here. And then, the quadrangular space. The triangle is the next thing I'm talking about. The triangle is kind of in the similar region, but different borders. There's the superior borders, the teres major, is the superior border of the teres major is the inferior border of the triangle. And then the long head of the triceps is lateral. So, so this teres minor is what that should say, is why I'm confused here. Teres minor, the superior border of it is the top of the triangle, and the lateral border is the triceps brachii long head, and then through it comes the circumflex scapular artery, which is, from where I showed you earlier, the one branch of the axilla, the subscapular artery. So just come back around. Here's the axilla. Here's the subscapular artery. Coming off the subscapular artery is the circumflex scapular artery, which travels through the triangle, which has an inferior border of teres minor and a lateral border of triceps brachii long head. And then, once again, here's the circumflex scapular artery, which is going to provide blood to the couple of the muscles of the rotator cuff, which I'm now starting. So the rotator cuff, the rotator cuff basically can be summed up in the acronym SITS: supraspinatus, infraspinatus, teres minor and major, and subscapularis. So supraspinatus is located in the supraspinatus fossa. So here's supraspinatus, and below it is the supraspinatus fossa. It aids in abduction of the arm, abduction, that first 15 degrees I was talking about. Its blood supply is the suprascapular artery. So if you remember from the other video I had, the suprascapular artery is the one that travels over the scapular notch. So if I show you an anterior view of the scapula, here's the scapula, here's the scapular notch, here's the ligament I was talking about, the superior transverse scapular ligament. And in fact, I'll just fade this, that'll probably be easier. You can see that this is traveling over top of that ligament instead of through the fossa, and this is what's providing blood supply to the supraspinatus muscle. The nerve supply is the suprascapular nerve, so pretty easy. Suprascapular nerve travels through the fossa, is the nerve supply. Suprascapulous artery doesn't travel through the fossa, is the blood supply. I guess one other important clinical point is that the supraspinatus muscle there can be impingement, where basically you have a really large deltoid muscle, and as it grows, it causes the space between the acromion and the humeral head to tighten or get thinner, and then you get impingement of the supraspinatus muscle or tendon, and then it kind of wears away, and that results in even weaker rotator cuff muscles, and then that kind of exacerbates the process, and you get chronic chronic rotator cuff weakness. Okay, so on from the supraspinatus, below that, if I'm just going to go to the left side of the model where I have it, below that we have the infraspinatus muscle. So I'm going to get rid of the deltoid here, and we have the infraspinatus muscle, which is in the infraspinatus fossa of the scapula and attaches to the greater tubercle of the humerus. It allows for external rotation of the arm. So you can imagine if the fibers are contracting this way, your arm is going to externally rotate because it's attaching to the outer side of the greater tubercle of the humerus. And so the arterial supply of the infraspinatus is the suprascapular artery, which is the same as the supraspinatus and the suprascapular nerve. So those guys have the same arterial and nerve supply. One important difference though is that the supraspinatus can't externally or laterally rotate, but the infraspinatus can. Okay, so teres minor and teres major. I'm just going to get rid of the infraspinatus so we can better see them. And I don't have teres major over here, so I'm just going to come back to the right side instead and unfade this. There we go. So just going with the acronym again, SITS, we have the supraspinatus, the inferior spinatus, which is not here because it's been removed, teres minor, and then teres major, and then the S is the subscapularis, which is on the anterior portion of the scapula, which I've highlighted here. So on to teres minor, its arterial supply is the circumflex scapular artery right here, and that's the one that traveled through the triangular space. So here's the triangular space, here's the circumflex scapular artery, and that provides blood supply to the teres minor, and its nerve supply is the axillary nerve. And the axillary nerve, if you remember, is this nerve right here. Sorry, just going to go like this, come back around, zoom in, is this nerve right here, which supplies innervation to the deltoid as well as teres minor. So coming back to the right side of my model, zooming out a bit, and its action is it allows for external rotation and adduction of the arm. So similar thing to the infraspinatus, and it also allows for adduction, which is bringing your arm back towards the midline. Finally is the teres major, which is supplied by the circumflex scapular artery, and so similar to teres minor, but its nerve supply is different. Its nerve supply is the lower subscapular nerve, not the axillary nerve. And since it's inserting, if you kind of go around here, you can see it's inserting on the medial side of the humerus. So the rest of these guys were kind of inserting on the greater tuberosity of the humerus on the lateral side. This guy, teres major, is inserting on the medial side of the humerus. It's instead of instead of externally rotating your arm like infraspinatus and teres minor do, it's going to internally rotate your arm. It still aids in abduction, but it's internally rotating instead of externally rotating. And then finally, just coming back around, I've talked about this several times, just going to get the biceps out of the way here, as well as pectoralis minor. There we go. Finally, the subscapularis is kind of the last member of the rotator cuff family, and it originates from the subscapular fossa. It inserts into the lesser tubercle of the humerus, very close to the teres major. And because of that, its action is internal rotation and extension of the arm. So extension and flexion. And its nerve supply is the subscapular nerve, as well as the brachial plexus. Basically, the brachial plexus contributes something to all of the rotator cuff muscles, but I'm sure we'll hear more about that tomorrow. And its arterial supply is the subscapular artery, which I've talked about a couple times. It's that one that gave off 2 branches. It's just being belligerent right now, not letting me click it. So there's the subscapular artery. This provides pectoral, or the subscapularis muscle. There's actually a really good, as far as blood supply goes, I know it can be a bit tricky. Our lecturer right before the Christmas break had a really good, like, drawn out kind of Livy anatomy thing on it. Just check that out. It's really good for the blood supply. It's probably doing a better job of explaining it than I could. But yeah, I'm basically done. I've covered the arms and stuff myself, but I don't know if I'll be able to making a video on them today. I have a couple other things to do, maybe later in the week. And then the same with the brachial plexus, which is right here, and provides innervation to a bazillion things. But I might cover that stuff later in the week after we've appropriately covered them in class, just so I'm not getting too much stuff wrong or anything like that. So yeah, I will see you guys tomorrow.